Let's bring in Professor Dr. John Boffa. He's a GP and a long-time advocate for alcohol restrictions in Alice Springs. John Boffa, thanks for your time. First of all, the Prime Minister's language today in that interview on this program with Andrew Clennell a short time ago, he says he's really keeping open the option of that blanket ban being reinstated as early as next week. No doubt you would welcome such a move.
Yeah, look, I think that option has to still be on the table. I think we've seen an announcement of some really important supply reduction measures. We know there's a very strong evidence base for a takeaway-free day, and we've got 2 days a week now, which is takeaway alcohol-free. That will work. But we've got restricted total takeaway trading hours. We know that reduces harm from previous evidence where it's been done. But whether it's as effective as what we had is a big question. And I think we still need to go down the path of the opt-out system, which has been talked about, to look at getting the other restrictions that we had back in place.
So at the very least, the opt-out option is what you would hope that this consideration, it's not a long period, it's been, Prime Minister's given it a week to report back, but you hope at the very least that opt-out option is undertaken. I know that was the advice that was given prior by leaders in Alice Springs. In fact, you and others said you wanted that ban to remain. It didn't, but at least if they go down that opt-out model, it would be an improvement.
Yeah, but of course the opt-out model does require legislation either at the Commonwealth or the territory level, so that can't happen immediately. In the next week, we'll find out whether there's support across a range of organisations, not just PAC, Congress, Legal Services, but others as well in the community for that opt-out model. So that's what we'll find out in the next week. That does require legislation to bring that back in. In the interim, what we have got is an immediate change, a very significant change in reducing supply, which will make an immediate difference. That's important, but this time round it's vitally important that the longer term social determinants of dependence and addiction are addressed. There's a commitment to an alcohol management plan that needs to look at those things. So we need to look at the level of early childhood programs across Central Australia to deal with early childhood trauma. We've got to look at education, participation, education attainment, teacher recruitment, teacher retention, bilingual education. All of that's got to be looked at as employment, poverty. All those things matter in terms of addressing the demand for alcohol, which, so supply reduction is part of the equation, services and programs and additional services and programs are part of the equation, but addressing the social determinants of addiction, excessive alcohol use has got to also be part of the equation, and that's where it does cost money. But Australia is a wealthy nation, and, we're talking about a region of the country with 20,000 Aboriginal people in it, so we can do this, and this is the time when we really need to get serious and make a longer term difference.
Yeah, exactly. Out of this crisis, let's hope there is some progress. As someone, and I ask you this as not so much as a doctor, but as a local, as someone who knows and loves the place, do you have any optimism for Alice Springs?
Oh, yeah, I do have a lot of optimism. I think, we've seen we can make a big difference. Look, we're seeing, on a more optimistic front, the median age of death for Aboriginal people in Central Australia has improved more than 10 years since 1998. There's been big improvements in life expectancy because of the improvements primarily in the primary healthcare system and the hospital system, as well as the alcohol reforms and Opal Unleaded. And now remember, Opal Unleaded, when it came in 2007, there were 6 to 8 deaths a year of young people. Prior to that, since 2007, there's been 1 death. So all these people who say supply reduction is a Band-Aid, it wears off, Opal Unleaded for 15 years has removed, if you like, the tragic premature deaths of young people, the brain damage that was happened. That was an effective supply reduction measure. In the same way, alcohol supply reduction measures need to be part of a package of measures for a long period of time. We're talking intergenerationally here. We've got to make a difference intergenerationally before we have a population that is able to live freely and safely with alcohol.
Professor John Boffa from the People's Alcohol Action Coalition, I appreciate your time and your insights on a big couple of days for Alice Springs and for First Nations people. Thanks so much.
Thank you, Kieran.